Now
Let's roll.
there we go.
Okay, we are here to learn wrist and wrist protocol. A lot of people have a lot of hard times with wrists. Okay, now wrists, there's a huge movement in wrist pain and wrist problems. Wrist carpal tunnel is a very big one, where the nerves of the arm come out and they go through this tunnel. We're going to go through the anatomy of that. They go through a little tunnel in the wrist with these wrist bones, and the wrist bones can actually sandwich and collapse onto the nerves. When the nerves get called subluxation or pressure, that can cause symptoms of numbness, of tingling, and of weakness of the hand. Okay, and it can even go up the arm. Okay, that's one of several different wrist conditions. Hand weakness, numbness, tingling, things that happen to the flexor tendons called tenosynovitis, or trigger fingers, trigger thumbs. Okay, many people complain of wrist-related issues and injuries. When a holistic kinesiologist sees a wrist, you got to know, okay, well, how do we do this? How do we attack this? How do we approach it? Many times when we start to look at anything, we go, okay, we fall into a habit of just touching the area of concern and then doing the healing format. But in like shoulder, like TMJ, like neck protocol, back protocol, it's good to have good overall techniques, okay, to kind of go after it for like a rehab type of approach. So on this protocol sheet, I wrote here subjective complaints under the history. So let's take a person with what looks like carpal tunnel, okay, and they're coming and they're complaining of hand pain, wrist pain. Maybe it's worse while they're sleeping. Maybe they wake up in the middle of the night and it keeps them awake because their hands go numb. Maybe they're they've got too much pain to grab onto their rake or their jackhammer, whatever they're doing, their construction, whatever they're doing during the day. Maybe it's causing them pain at the computer and at the mouse. Maybe there's something there, and you're wanting to help them. So you want to know what their subjective complaints are. So in this case, it'll be wrist pain. Let's just use that. And then you say, what type of pain? Is it sharp? Is it shooting? Is it throbbing? Is it aching? Is it numb? Like get the quality of pain out. For anything you ask that. It's like, even if it's like somebody has a neck pain, well, what do you feel in your neck? Is it achy in your neck? Is it sharp? Do you feel burning? Do you feel aching, throbbing? Like get the quality, because the quality oftentimes kind of tells you where it might be coming from. Because if the wrist is numb, that tells you something. I can't feel my hand. How long has it been there? Well, it's been there 5 years. Numbness for 5 years versus, yeah, it is a little achy. I mean, they're completely two different aggressiveness on the pathology, on the problem. So yeah, they have sharp, oh yeah, every time I go to pick something up, it's sharp and shooting. It sounds like, oh, nerve, something's happening there. So it tells you a little bit about what to go after, okay? The next thing that you're gonna ask is, does it refer upward or downward toward your fingers? Do you feel it in your wrist, and do you feel it moving downward toward your fingers, or do you feel it moving upward towards your elbow? And they may remark, well, I just feel it in the elbow and the hand and the fingers. They may even say, I have a patient right now where he's got numbness of his whole hand, but pain all up his arm. It's almost like damming a river. It's like if you trap a nerve, it's almost trapping the flow. It's like it becomes excessive on one side. It's like acupuncture will kind of do that. Excessive on one side and deficient on the other. It's numb down the river, but up the river it's backing up with pain and inflammation, okay? So you just want to know some of those questions. And then the mechanism, like how did this occur? Did it occur, did you injure it? Is it repetitive stress from work? Like what happened here? What's going on? Find out when it first occurred and how it first occurred. Like how long have you had it and what brought it on, okay? In this patient's case, he would have said, oh, it's for years of overwork. He goes, He said to me, he goes, I'm a gladiator who lived too long. He's now in his 70s and everything hurts, right? So he goes, I should have died as a gladiator in my 30s, and I would have been done with all this stuff. I said, well, that makes a lot of sense, you tore your body up young. And so the idea is, well, maybe it comes from a repetitive stress injury and lifestyle and old sports and old work-related injuries. The next thing is you want to know is on the pain scale. So I have these written down. Pain scale of 1 to 10, 10 being terrible pain. I always lead it like that. Like on a scale of 0 to 10 or 1 to 10, 10 being terrible pain, what number are you? Okay. And they'll remark for wrist and carpal tunnel, they usually say some 7 or 8 or 9 because carpal tunnel is very uncomfortable. It's not like really mild. Once you pinch a nerve, it's hard to deal with. Anyone ever had a pinched nerve, like a pinched nerve? They're miserable. They feel awful. So usually with these type of cases, you want to be empathetic and gentle in your approach so that you're not threatening because they're already in a lot of pain. So you want to validate that by your gentle approach. Okay. All right. So once you look and you figure out, or you're going to start looking and you're first going to palpate the pain. So when you see the wrist, okay, let's take this. Let's do this wrist. Okay. I don't need to take some off. So go ahead and go palm up. Now you're looking for swelling and edema. You can look at both hands, guys, and usually if they have, like say they have, if she were to have a right-sided wrist issue, you're looking to compare right and left. So if the right thumb is swollen, make a mark, right thumb swollen. If the hand's swollen, hand swollen, okay? If it's red, if it's whiter than the other one, like if there's not enough blood supply, make a note. Look at the color, look at the shape, feel the temperature. It might be hot on one side, it might be cooler on the other. Make note of what you find objectively, your objective viewing. You're viewing it, okay? Then what you're going to do is once you do that, you're going to check the range of motion. And I wrote down here range of motion. So there's active range of motion, which is flexion, extension, radial deviation, and humeral deviation. So flexion of the wrist. So follow me and do it on both sides, and I want to see what's going on, okay? Go ahead and flex your wrist. Flexion is flexing. In a case of carpal tunnel, they'll be like this. Like one will go all the way and the other one will be like, 45-degree angle or something. They're unable to get it flexing on one side, okay? All right, now make a stop, okay? This is extension. That's the range of motion for extension. Okay, got it? So this is flexion, this is extension. Radial deviation is this. This is the radial bones on the inside. It comes over and wraps over the ulna. So the thumb side of the wrist is the radius bone. Okay, the thumb side is the radius. Radial deviation, that's what they call this. It's like an inversion. Okay, be inverted, but it's called radial deviation in physiology, biomechanics. This is ulnar deviation. This is the ulna bone. It's on the outside. So this is radial deviation. This is ulnar. So you'll check to see what their range of motions are like. Make sure they don't flip, and then just try to keep them parallel and go radial deviate and ulnar deviate. And that way you can see what the range of motion. If the range of motion is unequal side to side, for instance, if they've got a right-sided wrist complaint and their left side's ulnar deviating, out, it's probably 30 degrees or something, and the right side's not moving at all, you just make a note. Restricted range of motion, ulnar deviation, okay? Make your notes. It's very important to keep records so you know where you were and where you're going, okay? All right, so those are the 4 different range of motions, and now we're gonna do kinesiology. Now, you have some muscles in here. The extensor muscles, the one that do extension, are called the extensor pollicis longus muscles. They're extensor pollicis muscles. They come down the back of the forearms when these muscles contract, they pull the wrist back, right? They pull it back like this, okay? So they're going whoop, like that. That's the extensors, okay? Then you have the wrist flexors. So if these are extensor pollicis, what are these? Flexor pollicis, okay? Pollicis means the hand, fingers, okay? The pollicis, okay? So the forearms, the front, this is the front because this is anatomical position. The front of the forearms are flexor pollicis. So the backs of the arms are the extensor pollicis and the flexor pollicis, okay? Then you have wrist pronator. So this is pronators. Now, pronator is like this. To pronate is to put down. And in this case, it's palm. Palm down is pronator. Okay, so if you're lying down on your face, it's called pronation. Lying face up is called supination. Okay, so pronator teres and supinator muscles. Okay, so that actually makes sense. Okay, finally something that actually makes sense in the body with, Latin. So we go pronator, supinator. Got it? So we'll work on that. Pronator and supinator. All of these are muscles that you're going to test, and I'll show you how to do that. The next one is Ponens pollicis test. Now the opponens is to opinate. Opponens is like this. To opinate the thumb and the pinky finger together, like that, is the opponens pollicis. That's this muscle here. This meaty muscle right here, we call it the thenar, right? That thenar that you do with the contact chiropractors to get the thenar contact or hypothenar contact. That's this muscle here. This is actually the opponens muscle, okay? So the opponens pollicis are the ones that opinate. To opinate is that. That's that motion, to opinate, okay? So now let's go through them again. What is this? Extensor pollicis. What is this? Flexor pollicis. What is this? Pronator. It's actually pronator teres. And then palm up.
Supinator.
And this is supinator. Okay. Then what do we have here? Opponents. Okay, opponents. Now let's do all of these in sequence. So when you are testing the wrist, are we okay there?
Mm-hmm.
Pull the wrist back, hold there, and resist as I pull. Remember your muscle testing.
Mm-hmm.
So it's like this. So you stabilize the underside, and then you just gently open hand over the top of their hand, push down. Resist as I push. Very good. Okay, and again, you're just feeling for the lock. If there's no lock, blow through it. If it's weak and you blow through it, it's weak. So how do you list that nomenclature in your chart? Because remember, it's out of /5. Okay, so it's 4 out of 5. If they're really weak, like they hardly hold any pressure at all, it's 3 out of 5. So you get a hallmark on how strong these things are again. Okay, cool? Remember that? Okay, good. All right, so that's the extensor pollicis. Let's do flexor pollicis. Now you can do this in the same position. So she goes extensor. Okay, this time just drop it down into flexion, all the way down. Make sure they go all the way down. Okay, now they're gonna drop it like that. Okay, then you're gonna opposite hand stabilize and pull back. Okay, just like that. And that's the test. So if they blow out weak, it's 4 or 3 out of 5. If they're strong, it's 5 out of 5. Cool? And you make a note in the chart. Now, that's great. Good job. Let's do the next test, which is the pronator test. Now, hold the elbow to the side, like pull it in, and make your hand go down like this, okay? Now, she's in this position. Go ahead and shake my hand. Hold my hand, okay? Now, what you're trying to do, come on over, camera. What you're trying to do is you're trying to open the doorknob. So the doctor is trying to open the doorknob like this. So you're trying to do this thing, okay? They're holding it down. Resist this motion. Resist my motion. So I'm pushing. I'm literally just trying to do this to her. And if the pronator is strong, it will hold me down in that position. I won't be able to release it. Okay? That's the pronator test. Now let's do the supinator test. Do this, palm up. Okay? Now, hold my hand. I'm going to try to close your hand down. I'm trying to pronate you. Hold that position. So I'm trying now to go this way. See what I mean? Take that thumb over this way and make sure, see what it's doing, okay? Don't go this way still. You're trying to go back down again, the normal motion, okay? Supinator, pronator. And if they go weak, you make a mark of that. So those are the main muscles that you do for the forearm and the arm, okay? The flexors, this is all the forearm, okay? You did the flexor, you did the extender, you did the pronator, you did the supinator, cool? Now, the last part is this. Thumbs opinating. Take the thumb and the pinky finger together. Make an O. Can you make an O? Great. A lot of people with carpal tunnel, they have a tough time making an O like that. It's hard on their fingers. It's harder on them, especially if they've had it for years. Now, what you're trying to do is like an O-ring test. Take this hand down for the camera. You're going to be pulling apart here. Okay? So come around here. Just show right here like this. So your thumb, you're grabbing the thumb one side, and you're grabbing the finger, the opposite finger on the other side, and you're pulling up straight out apart, trying to break the link. If they're strong and the clear, they hold the lock. If they're weak, go weak, they blow out like that, okay? So that's what that is. So that's the opponent's test. So on this video one, we're simply gonna just do all those, we're gonna do the history, then you're gonna do inspection, then you're going to do a range of motion, active range of motion, and then you're going to do some kinesiology, applied kinesiology, which is testing the peripheral muscles. Okay, so we're going to do this on this section one. All right, there we go.